I spent some time in college working in the ER and third shift as a tech, decided that that was really where I wanted to be. Went to medical school and got on the orthopedic service and realized like these guys fix people. They make people better and they get them back to where they were before, compared to some of the other medical specialties where they're often managing problems but never fixing anything.
A lot of our life as orthopedic surgeons is trying to take people that can't do what they want to do, whether it's because of pain or literally the joints or muscles or tendons aren't allowing them to do it, and to let them get back to what it is that they want to do.
It's taken us 2 years to get to the point to really find the best way to integrate from physician to therapist to trainer, or from trainer, therapist, trainer, doctor, and really to find out the best way to build a program, to build a center that has all functioning aspects that aren't just in a center, but are actually working together. And so I was sold on the idea of it, and we have and are continuing to build that program to meet the client's needs.
Our goal is to give that individualized one-on-one care every time. So when you come in, you know that you're going to see the same therapist. You know that you're going to have a consistent flow from beginning to end, so that hopefully you don't lose any ground, there's no communication breakdowns. Gives us a great opportunity to sort of use our close proximity and relationship with the physicians to help the patients have a little bit better outcome.
In the spring of 2010, I was on a family vacation in Park City, Utah, and we were skiing, and at one point we were on a little bit more challenging of a run, but everyone was doing fine. And as I was coming around a corner, I kind of caught an edge of snow, and as I turned, my knee basically stayed in one position and my body went the rest of the way around the turn, and basically tumbled kind of head over heels, lost skis, gloves, everything, and I knew that I really had hurt myself, and the day of skiing was over.
We got x-rays, we got an MRI here at our facility, and it showed that she had torn her ACL. An ACL tear is an anterior cruciate ligament, one of the ligaments in your knee that you need that keeps the thigh bone and the shin bone connected so they don't move independently of each other, okay? When you tear that, the knee fills with blood. And it's very painful and it limits your motion. That alone hurts, okay? And so the first thing we do is put folks in something called prehab or prehabilitation, where we're working on getting the knee back in shape. We get rid of the swelling, we get rid of the blood, we get your motion back. Even though your ACL is torn, it gets your knee feeling better. And then you make a decision about whether or not you want to have it reconstructed. Not everybody does, but most do. And in Brenda's case, she's very active. She hikes, she's outdoors all the time, she skis, she's often on uneven surfaces, and so she elected to have her ACL reconstructed.
She came to see me then shortly thereafter surgery. We started with a formal course of therapy. We saw her for a good 3 months, I think, post-operatively, and really worked hard on getting her back, just doing things in her daily life. Working on getting her flexibility back, working on getting her walking, going up and down steps, starting to work on some balance and some more functional type of activities. Great opportunity to sort of meet a great person. You know, she's really, really fun to work with, really had a great motivational level.
By definition, sports medicine the goal is to get you back to what you were doing. You know, the day that the physical therapist discharged her from physical therapy as quote unquote done, she wasn't done. She could not have gone skiing that day because she hadn't done anything else for the rest of her, because we've been restricting her for so long, her injury and then the post-operative restrictions. And so the movement specialists downstairs are really great at getting you back into shape as quickly as possible and helping you get ready for whatever season you're preparing for.
It was the right choice, and I'm just pleased that I am to the point where I am and can do the things that I want to do.
That's really good. This is the first time you've ran hard? Yeah. All right. Do a few more, maybe 2 or 3. Give me 100%. Okay. Big arm swing. Push off the ground.
We're partnering with these patients, with these clients, to put them in the right path of health, of wellness, of healing. Every person's gonna be a little different for how many visits they need to be with a therapist before they can be transitioned onto a trainer. And so when that therapist and that patient in communication has decided that they've made progress and that the progress that they were making has come to a halt or is the best progress they're going to make, then that immediate nice pass off, that handoff to the trainer then is right there to proceed to the next step, to then take them from the shoulder issue that they had and move that into a total body mechanics, to see how the body then has to readjust, relearn its mechanics to how that shoulder and the core reintegrate, which always has to happen after an injury.
October of 2009, was playing a course with a bunch of friends of mine on a 9-foot rim. Decided to do a dunk on it, shifted my shoulder back. It just felt like I pulled a muscle or just tweaked my shoulder the wrong way. It wasn't, I mean, we still played horse for another hour after that. I just didn't try to dunk the ball anymore. In the spring, when I started to play baseball, I had the pain, talked to a few people I knew, and they mentioned some things about the Orthopaedic Center. And then for me, it was just kind of, I knew something with my shoulder, so I figured I'd just go and bypass going to see my family doctor and like that, and just went straight to the Orthopaedic Center. As well as I got a little boy. He's 4 years old now, and he loves baseball, so as he gets older, I wanted to be able to play baseball and throw a ball with him in the backyard and stuff like that without having to worry about my shoulder hurting or being less able to throw a ball.
And to hear somebody that wants to be able to throw baseball or to pitch the football in the backyard, and he sees that with this young child that he hopes to be able to throw a ball with for the next decade or so, that he's not going to be able to do that, and that's important to him. And we tried extensive conservative treatment for him, and we were able to provide imaging services in order to help confirm the diagnosis. And then when the conservative treatment didn't work, we were able to do surgery.
I saw Dwayne several weeks then post-operatively, had the opportunity to sort of work on getting his range of motion, because early on you've got to be very protective and very cautious when you're dealing with a post-operative shoulder. It's a little bit more fragile than other things that have surgery, so you have to work really diligently on getting your motion back. The shoulder has a great deal of motion, and if you don't get that motion back within the first couple of months after surgery, you really struggle getting back to that activity level that you really desire. You know, our goal as therapists in that early process is to get him moving. You know, keep his shoulder from getting stiff and try and get back his passive mobility, i.e. when I'm moving his shoulder, I want to be able to get him full mobility when I'm moving it, but not necessarily when he's moving it. You know, then you progress into things where he's more active, where he's working on building back his motion, moving efficiently and smoothly, and then we work on building back his strength and getting him ready to go back out and throw the ball, you know, pick up his kids and those type of activities.
With this elbow, we're going to take and we're going to almost draw like a semicircle in, and then we're going to let that come out, and my hand actually drops in behind my head right now.
The majority of the time of the trainers in the peak is spent doing movement correction and then strengthening those movements. So when a therapist gets that patient out of pain and gets them to where they're at the point of discharge from therapy, the peak trainers then take them to a whole body movement, and then we strengthen those movements through fitness, through strength training, because if you don't strengthen those movements, then those movement patterns really aren't your own. So you need to strengthen those patterns to really be able to use them on an everyday life. So we take people, we teach them how to move, we strengthen those movements, we teach them fitness programs, and we give them the tools they need to prevent injury in everyday life activities.
Woo! That's good. All right, now take a couple steps back and let's go ahead and we'll do that walkthrough as we go through. So just remember, we're working our feet on that line.
He really wanted to get back and play softball at a fairly competitive level. You know, so Eric had the opportunity to work with him, get him into a throwing program, and really work on his throwing and shoulder mechanics so that he could be as efficient and smooth throwing the ball as possible, and also making sure that he was throwing the ball correctly so he didn't have a re-injury or have any other problems as he got back to playing softball. You know, and since he's been done with the rehabilitation course here and done with working with Eric, he's gone back and he's been able to play with his corporate team back at the softball diamond.
The Orthopaedic Center definitely helped me in every way as far as being able to heal from the surgery and progress in a timely manner so that I could do the things I wanted to do without having to re-injure myself or put myself at risk.
There's plenty of people that need help within their wellness and plenty of people that are getting hurt. And so we want to give people the tools that they can prevent coming back in and seeing their doctor, prevent seeing that therapist or that trainer on a regular basis.
We can really work with one of our movement specialists or our certified strength and conditioning specialists who can really push you and motivate you and really help you function at a higher level so that when you're ready to step back, when you're really done with your course of rehabilitation, you're ready to step back onto the field and court and really ready to compete at a very high level versus being tentative and not really prepared to really get back to that level of function as you were prior to your injury or your surgery.
We have a unique thing. I mean, it's easy to keep saying, but I mean, like, we offer something nobody else does, and we offer it because of the size of our group. By having 11 guys working together, we are able to really do things on a grander scale that a 2-man or a 3-man group could do. And it's easy to be proud of it.